Hey guys, welcome to our series on gynecomastia. We'll be speaking on what is gynecomastia, how we treat it, and what care you need to take after the surgery. Hi, I'm Dr. Saumil Shah. I'm a board certified plastic surgeon practicing in Borivali West in Mumbai. I am the director of plastic surgery division at Skinzone Aesthetics. So let us go through what is gynecomastia. Before understanding gynecomastia, let us understand what a normal anatomy or normal chest, male chest, looks like. Think of it as being in layers again, like how we think of our previous series in liposuction. So this is basically the topmost layer is again the skin. Below this is a thin layer of fat. Below that is the muscles, the pecs that we use to build up during our exercises. Below that are the ribs, the bones. Below that are the lungs and the heart that are there, that all these structures protect. Now, during gynecomastia, what happens is right beneath the skin, in the thin layer of the fat that is there beneath the skin, there is something called as a gland that appears. Think of this gland as an extra appendage, like an extra finger that occurs in a few people, in a few males. Why this happens, how this happens, we'll speak again. But this is what causes gynecomastia and what is gynecomastia. Gynecomastia is not just excess fat that is there under the skin, but it is the presence of this gland that makes gynecomastia. Now, why does this gynecomastia occur? The cause of it in medical literature, the most common cause is called as idiopathic, which is just a fancy way of saying that we do not know. So the most common reason why gynecomastia occurs is we don't know why. Let's see how it usually happens in young males. Between 10 to 12 years of age, during puberty in young males, 100% of males develop what is called as this gland. Now this gland sort of goes away on its own or withers away in most of the males. But in 20 to 30%, which mind you is a conservative number but quite a high number. So out of 5 people you know, 1 person, or even out of 3 people, 1 male does have this condition of gynecomastia, where this gland stays back. The reason why this gland has stayed back, we do not know. It is not because you have eaten something, it is not because somebody has done something wrong, it is not because any medication was taken or you had any fever, or not because you have not done something. So the reason why it occurs is, as I said, idiopathic, or we do not know. There is a very small subset of patients, like in gymmers, where they take what are called as anabolic steroids, where these can happen. There are certain medications such as for epilepsy and for some other issues that they are taken where these do occur. But they are again a very small part of the total number of patients that we see. As I said, the maximum number of patients whom we see are of causes where we don't know why it is there. But it is just like a 6th finger where it is there. It does not cause any harm and it won't lead to any other bigger problems. So this was the video on what is gynecomastia and how it occurs. In our next segment, we'll be speaking on how we treat gynecomastia, how our surgery is a little different from how other surgeons treat it, and what care you need to take in the post-operative care of gynecomastia. See you there.